Start.
Hello, this is Dr. Vinay. I am a veterinary surgeon. I specialize in anesthesia and surgery and emergency care of the patient. And I would like to pass on a very strong message. And please remember that your veterinarian is a human being and he is in the line of fire all the time because he's trying to save patients and he is the barrier between life and death. Not all times we are in a position to save our patients, but it does affect us personally when we are at that edge of always life and death situations. I feel very saddened when I see veterinarians getting abused, when I see that people are not being kind to them. Please remember, at the end of the day, we are just humans trying to make a living, trying to do as much as we can, and we do try our best to save our patients. And for example, in this case, I always compare our work with meditation. The reason is, if you see this particular patient, he was awake, I have given anesthesia, I have set up the anesthesia over here. So if I have to explain to a veterinarian or even to a layman what we do as a surgeon, as an anesthetist, we have to induce a state of deep sleep here, and we have to take help of medications to control the pathway of pain so that they don't feel pain, and make sure that the vital organs are working perfectly in harmony, do the procedure and then bring them back. So the most challenging part of my work is to take them into that deep state of hypnosis, okay, which is very close to the point of no return, which is called as death. As a veterinarian, every day the challenge is I have to go in that deep state of meditation where I take the patient goes in physical presence and I need to be there in my mental presence. I need to go very close and be there as a barrier over the edge between life and death of the patient with my monitoring, with my veterinary skill. But remember, at the end of the day, even though I'm a professional, I'm just a human, and we try our best to bring them back to safety. So literally every time we touch death and come back, we go very close to the death and come back. And as a human, sometimes we are not able to bring them back, and often we get abused, often we get judged because how could you do it, please remember, when there is a loss of life, it does affect us personally because we are there to witness that procedure in a professional way. So please be kind to your veterinarians. Remember, your veterinarians are humans. The situations or conditions inside the body are not entirely our control, and I always encourage veterinarians' welfare. Please consider the welfare of your veterinarian, because if the veterinarian's welfare is secured, the veterinarians and their professional training is fully capable of taking care of animal welfare. And be kind to your veterinarian because he is trying his best, and we just have to make sure that we understand how difficult it is to be a veterinarian, and we have chosen to be in this profession and we are trying to do as much as we can, but it is always this life and death situation that we are facing, and we need to make sure that we are able to take care of ourselves so that we are able to take care of them by being on that edge, which is not an easy task. So please be kind to your veterinarian and make sure they get respected. If we veterinarians are provided the resources, provided the skilled help, and provided a welfare situation for us, I'm sure we can do wonders in our profession and bring complete harmony to the human, animal and ecosystem welfare, because I belong to that unique community of veterinarians, and I'm speaking for one and all, where we are the only connecting link between the human, animal and the ecosystem welfare. You cannot be a balance in this without connecting these dots, and we are those dots. I am just one dot, and there are lakhs and lakhs of dots around the world and thousands around the world. Please be kind to them. They are trying their best, and we hope that we are able to do this on a long term. Thank you so much. Yes, so this was